Welcome back. The time's now 7:13, and you don't have to wait months or years to see your health improve after you quit smoking. And while it may not be easy to do it, it is possible. Dr. Brent Wallis from People's Health joins us to share some more smoking cessation tips and information that you need to know to live a healthier life. Dr. Wallis, good morning.
Good morning. Thanks for having me.
Of course. I feel like people know by now, but I don't think it hurts to remind them about the dangers of smoking. Talk about all of the things people put their self at risk of dealing with health-wise if they smoke.
Yeah, sure. Definitely, I think most people know by now that smoking, cigarette smoke has thousands of chemicals in it, formaldehyde being one of them. And those chemicals can actually lead to a lot of diseases, heart disease, lung disease, and definitely cancer. A lot of people don't realize, though, that cigarette smoke can also cause early aging, wrinkling, and for men, even erectile dysfunction. So, the other thing to always keep in mind is secondhand smoke can be very dangerous as well. A person who doesn't smoke but lives with a smoker has about a 30% increased risk of lung disease and heart disease. So it's not just affecting you, it's also affecting those around you.
And Dr. Wallis, what about the idea that, okay, I won't smoke cigarettes, I can smoke e-cigarettes and that'll be healthier? Is that so? Is that true?
Yeah, we don't know entirely yet. Vaping or electronic cigarettes actually still use a liquid that may or may not have nicotine in it. And there are a whole bunch of chemicals in that vapor liquid as well. Because they're not fully regulated by the FDA, it's actually just beginning now. We don't really know what all the risks of those are yet. So I think we'll know more in the next few years, but it's not necessarily a completely healthy alternative.
So it sounds like the safest thing is to just not smoke at all. But Dr. Wallis, I know there are people out there watching right now who are thinking, I've smoked for 5, 10, 15 or more years of my life. I've already done the damage. It's too late for me to quit smoking, to have my health improve. But that's not the case, right?
No, not at all. And I think that's something important to remember. Just a few minutes after you quit smoking, you can start seeing beneficial effects. Your heart rate returns to normal. In the first day, the oxygen levels in your blood actually return to normal as well. And then after a month, you actually can get about 30% of your lung function back. We always tell people, too, that 1 year out, if you can make it that long, your risk of heart disease drops by 50%. And if you can make it out to 10 years, you actually approach the normal risk level for lung cancer that a non-smoker would have. So now is really the time to do it. It's not too late.
And if people want to quit, they feel like they've gone over this 1,000 times, trying or thought about it, what are the best ways to start the process of quitting?
Yeah, it's a very hard process, and sometimes people have to try it multiple times before they're successful. I usually recommend that they try to talk to someone else who's quit smoking to see what tips worked for them. But the best way to do it is usually cold turkey. Get rid of the cigarettes. Take yourself out of any situation that may remind you of smoking or make you want to smoke. And then definitely talk to your doctor about alternatives. So there are some over-the-counter and some prescription medications that can help curb, that addiction and that desire to have a cigarette.
And really quickly here, if people need even more help, there are resources, free resources out there through the Smoking Cessation Trust or Cessation Trust. We have 2 numbers to give you, our phone number, 1-800-QUIT-NOW, and then there's also a website that you can check. That's all the information there on your screen. So check that out if you need help quitting to smoke. As you heard Dr. Wallis say, almost immediate benefits to your body and improvements to your health once you do. As always, Dr. Wallis, we appreciate your time.
Thank you very much. Have a great weekend.